Hi everyone, today in this video let us discuss about Rabeprazole. Rabeprazole is a medication that is classified as proton pump inhibitor, commonly known as PPI. We can identify the suffix prazole, which indicates it is a proton pump inhibitor. Medications like omeprazole, pantoprazole, lansoprazole, all these medications belong to the same category and they are classified as proton pump inhibitors. Rabeprazole can be used in the treatment of gastric ulcers, which are associated with excessive gastric acid secretion. When the gastric acid is excessively released, it can produce few symptoms like indigestion, flatulence, and bloating. However, if it is untreated, it may also lead to the severe conditions where gastric acid is refluxed into the esophagus. That results in the development of heartburn and esophageal irritation. The excess gastric acid release is mainly due to few of the lifestyle factors. Taking spicy foods, irregular food habits, and lack of mobility can also increase the gastric acid secretion, leading to development of gastric ulcers. In a few people, this condition may also be developed due to presence of any infection. Few of the bacteria like helicobacter pylori can produce excessive gastric acid secretion that develop symptoms of gastric ulcers. To treat all these conditions, rabeprazole can be used, which is available as a delayed release tablets. It is commonly known as SR tablets, where SR indicates sustained release tablets. Rabeprazole can also be combined with another medication, domperidone, and this combination can also be used to control gastric acid secretion. So today in this video, we are going to discuss about the rabeprazole, how this medication works, what is its effect on absorption of vitamins, how it affects your bones, and what is its effect on kidneys. All such important things we will discuss in this video. First of all, let us see how this medication works. Gastric acid secretion is mainly mediated by gastric parietal cells. The last step in this gastric acid secretion is carried by a pump called proton pump. This pump is also called as H plus K plus ATPase pump. This is an exchange pump which is going to exchange the proton for potassium ions. So when these pumps are activated, protons are secreted into the canal where potassium is taken into the cell. Normally this gastric acid is released in a controlled way. The release of gastric acid can be mediated by many of the factors like histamine and acetylcholine. However, the last step is mediated by the proton pump. Rabeprazole completes the final step in the gastric acid secretion. Due to the decreased gastric acid, the symptoms of gastric ulcers can be slowly relieved with use of rabeprazole. Now let us see the precautions of this medication. Use of rabeprazole can affect the functionality of your kidneys. It can produce a condition called interstitial nephritis. It is one of the acute conditions that involves inflammation of interstitial nephrons, and it may be developed during any time of therapy. This acute condition involves few symptoms like nausea, unexpected weakness, and anorexia, which results in the loss of appetite due to inflammation in the kidneys. People may also develop fever and skin rashes. So if you observe these symptoms, it may indicate some abnormality in your kidneys due to the use of rabeprazole. Then kidney functionality should be done, and in case of interstitial nephritis, this medication should be discontinued. Rabeprazole should be carefully given with other medications like warfarin. Warfarin is an anticoagulant which has a narrow therapeutic window. That means any fluctuation can significantly affect the clotting process as well as bleeding process. When you take the rabeprazole simultaneously with the warfarin, it can increase the prothrombin time. This time indicates the rate of clotting process, and with increased prothrombin time, clotting process becomes slow. That increases the risk of bleeding. While you take the rabeprazole along with warfarin, close monitoring should be done to check the prothrombin time to avoid significant risk of bleeding. Another important effect of rabeprazole is the development of diarrhea. Normally with use of proton pump inhibitors, diarrhea may be developed, but in a few people this diarrhea may be due to induction of bacterial infections. One such bacteria is the Clostridium difficile. It is one of the opportunistic infection that can produce diarrhea, and this diarrhea is called as Clostridium difficile associated diarrhea. It cannot be easily treated by using normal antidiarrheal agents. Since rabeprazole is going to modify the gastric environment, therefore it reduces the acidic environment in the stomach, which may promote the induction of bacterial infections like Clostridium difficile. Therefore, if you observe diarrhea with long-term use of rabeprazole and if it is persistent, then this drug should be discontinued. Another effect of rabeprazole is on your bones. However, this effect is not observed on short-term use. When you are using this medication for greater than 1 year, it can affect your bones. Particularly, it can increase the risk of bone fractures and it can induce osteoporosis like effects where your bones are weakened and easily broken. This effect on bone is also due to the decreased levels of calcium in the body when you are using the rabeprazole for greater than 1 year. Particularly the bones of hip, wrist and spine are more affected with use of this medication. So on the long-term use, people may have bone pains and bone fractures with use of rabeprazole. That's why it should be used for a short period in order to avoid adverse effects on the bones. However, in a few people, the bone fractures may be increased on repeated use of rabeprazole. Gastric malignancy is one of the conditions which is also associated with excess gastric acid secretion. However, this malignancy may also involve other symptoms like indigestion, abdominal pain, bloating, and weight loss. So these symptoms may resemble the symptoms of gastric ulcers, but whenever people are having unexpected weight loss, an examination should be done to check the gastric malignancy. Because rabeprazole is not effective in completely treating the gastric malignancy as it only reduces excess gastric acid secretion. Rabeprazole can affect your fundic gland and it can produce fundic gland polyp. This produces few symptoms like abdominal pain, weight loss and blood in the stool. So if you observe any color changes in your stools and red to brick colored change, which may indicate the blood in the stool. In such conditions, the fundic gland should be examined to check the development of polyp produced by rabeprazole. Rabeprazole can also interfere with absorption of few vitamins. It can induce the malabsorption. However, this condition can be observed when you are using the rabeprazole continuously on daily basis for greater than 3 years. So in such people, it can induce the vitamin B12 deficiency that can induce few of the neurological reactions and even anemia. Even though the side effect is observed on very long-term use of rabeprazole, in a few people it may be developed even for short-term treatment due to any pre-existing risk factors. In people with severe diarrhea or serious malabsorption, few disorders like diabetes, the vitamin B12 deficiency may be more pronounced with use of rabeprazole. When you're using this medication, it can also affect the magnesium levels. Particularly, it can reduce the magnesium levels leading to hypomagnesemia. When the magnesium levels are reduced, it can produce few symptoms like cardiac arrhythmias, palpitations, muscle twitching, and in the serious conditions, it can produce seizures. However, this effect can be observed on long-term use of rabeprazole. When it is used for greater than 1 year, the magnesium levels may be reduced. In such conditions, magnesium supplements may not be alone sufficient to restore the condition. In case of significant hypomagnesemia, rabeprazole may be discontinued because if this condition is untreated, it can also affect the levels of calcium and potassium. So with long-term use of rabeprazole, both calcium and potassium levels are reduced, leading to hypocalcemia and hypokalemia. The reduced levels of calcium can also affect your bones, leading to bone fractures. Therefore, on long-term use, the electrolyte level should be checked, and in case of hypomagnesemia, rabeprazole may be discontinued. Now let us see the side effects of this medication. Rabeprazole mainly produces gastrointestinal side effects. It can produce constipation. However, in a few people, it can also induce diarrhea. This diarrhea may be developed due to the bacterial infection like Clostridium difficile. Other side effects like flatulence and abdominal pain can also be observed. It can also produce pharyngitis, inflammation in the pharynx, and due to malabsorption, it can also develop anemia. Now let us the dosage of this medication. Rabeprazole is available as delayed release tablets. It is available at a strength of 20 mg. For treating duodenal ulcers, it can be used at a dose of 20 mg given once daily. The duration of treatment may be variable from 4 to 8 weeks based on the type of ulcer that is going to be treated. This medication can also be used to treat helicobacter pylori infection. However, rabeprazole is not an antibacterial. It is not affecting the bacterial infection. Instead, it can reduce the gastric acid secretion that is induced by helicobacter pylori. Therefore, rabeprazole alone is not effective. It should be combined with few of the antibiotics like amoxicillin and clarithromycin. In this combination, rabeprazole is used at a strength of 20 mg and it is given twice daily. This treatment can be done up to 7 days to eradicate helicobacter pylori infection. However, the duration of treatment may be extended based on the severity of the infection. What is rabeprazole? Rabeprazole is a proton pump inhibitor. It can be identified by the suffix prazole. How this medication works? Rabeprazole selectively inhibits H plus K plus ATPase pump. It produces irreversible inhibition of this pump, thereby it can reduce the gastric acid secretion. What is the important side effect of this medication? Rabeprazole mainly produces the gastrointestinal side effects leading to constipation, abdominal pain, and in a few people it can produce Clostridium difficile associated diarrhea. Which precautions should be taken while using this medication? Particularly when this medication is used for long term, it can affect your bones leading to bone fractures. It can produce malabsorption leading to vitamin B12 deficiency. It can also induce the anemia due to malabsorption. Even on long-term use, it can reduce both magnesium and calcium levels, which are fatal to the people. So that's all about this medication, Rabeprazole. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box. Thanks for watching. See you in the next video.